Imagine standing at the pharmacy counter. You know, you are picking up a prescription ointment to heal this incredibly painful, fragile skin condition on your most intimate anatomy.
Right, yeah.
You open the box, and the very first thing you see is this bold, all-caps warning label staring back at you. It literally says, "Do not use on genital skin. Do not use on thin skin."
Oh, it completely shatters your confidence in the treatment plan. I mean, the medical field is usually so obsessed with rigid protocols, you know. But this specific disease, it forces doctors to actively tell you to break their own most fundamental rules.
It's wild.
Yeah.
And we are looking at a disease today that is just defined by paradoxes like that one. And for you, listening right now, we know you were trying to cut through all the medical jargon.
Yeah, get straight to the facts.
Exactly. So you submitted this huge stack of heavy-hitting medical literature.
Yeah.
We've got the 2021 European guidelines, the BASH UK guidelines, BMJ best practices, and a whole slew of clinical dermatology reviews.
It's a very comprehensive stack.
It really is. And we've gone through all of it to answer your highly specific focal question for this deep dive, which is, can lichen sclerosus skin changes actually extend into the groin folds or onto the inner thighs?
And, well, the short answer is a definitive yes.
Okay.
But the mechanism of why it spreads to those specific areas is going to completely change how you view your body's interaction with the physical world.
Wow. Okay.
Yeah. But to understand that spread, we really have to look at the disease's origin point first. So lichen sclerosus, or LS, is a chronic autoimmune inflammatory condition.
Right.
And its signature calling card, if you will, is skin atrophy. So severe thinning coupled with hypopigmentation, which is just a stark loss of skin color.
And if I'm reading the demographic data from your sources correctly, the immune system seems to target very specific phases of life, right?
He does, yeah.
Because the largest group affected are postmenopausal women, but then there's this massive secondary spike in prepubertal children, particularly young girls. And, I mean, while it's less common, it absolutely strikes men and boys as well.
Yeah, and shifting hormone levels in those specific life stages, so like the drop in estrogen after menopause or that naturally low estrogen state before puberty, they don't cause the disease directly.
Okay, so they aren't the trigger.
Right, but they seem to create an environment where the underlying genetic predisposition for LS can suddenly just switch on.
I see.
And when it switches on, it is profoundly localized. I mean, in women, it almost always targets the vulva and the perianal skin. It forms this very distinct figure of 8 or like an hourglass shape of stark ivory or porcelain white skin.
Yeah, and the clinical texts, they keep using these terms like cigarette paper or cellophane to describe the texture.
Right.
But trying to visualize that on an actual human body is tough. To me, it sounds more like antique silk.
Oh, that's a good way to put it.
Like, you know when you find a really old silk dress in an attic, and the fabric has degraded so much that if you just pinch it, it sort of shatters and dissolves between your fingers.
Yeah, it just falls apart.
That's what the architecture of the skin sounds like. It's just lost all its structural integrity.
Because that structural collapse is actually happening at the cellular level.
Yeah.
So your immune system's T cells, which are, supposed to fight off foreign invaders, they become totally confused.
No.
And they infiltrate the epidermal junction. That's essentially the glue that holds the layers of your skin together.
Right, the glue.
And these T cells release inflammatory enzymes that literally dissolve the healthy collagen and elastin. So the skin isn't just thinning, it's very... Scaffolding is being actively chewed up.
Which completely explains that shattering fragility. Yeah. And in men, the epicenters are slightly different, right?
They are, yeah.
Because the sources point out that male genital LS almost exclusively affects those who are uncircumcised. It targets the tip of the penis, the glands, and the foreskin.
Exactly.
But instead of just that shattered silk texture, the tissue often reacts by becoming incredibly firm and scarred, like forming a really tight sclerotic band.
Right, because the inflammation triggers a chaotic healing response in the foreskin. So instead of replacing the damaged tissue with normal flexible cells, the body just rushes in with dense fibrotic scar tissue.
Okay, so we have this localized, really aggressive disease parked right at the center of the anogenital region. And I think this brings us directly to your focal question.
It does.
Because if the immune system is targeting the vulva or the foreskin, why on earth would the patches start showing up on the inner thighs and the groin folds.
Yeah.
I mean, the skin there is completely different.
Well, skin doesn't exist in a vacuum, right? It responds to the microenvironment that you subject it to. And what's fascinating here is a mechanism in dermatology called the Koebner phenomenon.
The Koebner phenomenon.
Yeah. So when an individual has an active autoimmune skin condition, experiencing physical friction, pressure, or like microtrauma in a totally healthy area of skin can actually pull the disease into that new location.
Okay, let's unpack this, because this is wild.
Yeah.
Are you saying everyday physical stress is acting like a homing beacon for a rogue immune system?
That is exactly what it is doing.
So if my thighs are just rubbing together when I walk, or if I'm wearing tight jeans that sort of dig into my groin creases, those normal everyday actions are creating microscopic injuries.
Yes, exactly.
And my body, while trying to heal those tiny injuries, accidentally deploys the defective LS immune response to the inner thighs instead.
You've captured the exact biological sequence.
Yeah.
The groin folds, medically we call them the inguinal folds, and the inner thighs, or genitocrural folds, they provide this perfect storm for the Koebner phenomenon.
How so?
Well, you have occlusion, meaning the skin is closed off and trapped without much airflow.
Right.
You have moisture from sweat. And you have constant repetitive mechanical friction with every single step you take.
Wow. You know, I noticed the BSHH guidelines specifically call out horseback riding and cycling, too.
Yeah, they do.
And it makes perfect sense now. It's not that the disease is contagious and spreading outward like a rash or something.
No, not at all.
You aren't catching it on your thighs. You are mechanically dragging the autoimmune response outward through the sheer force of friction.
Precisely. The mechanical stress literally alerts the circulating T cells to a site of injury, and they arrive ready to cause inflammation. And this phenomenon actually explains one of the most bizarre mysteries in the literature.
Oh, really?
Yeah, because if friction can pull the disease to the inner thighs, it can pull it absolutely anywhere on the human body that experiences trauma.
Oh.
We call this extragenital lichen sclerosus.
Extragenital. Right, because up to 10% of women with genital LS also have these extragenital patches.
That's right.
And about 6% of cases, the condition only appears on non-genital skin, which is crazy to think about. So where is this friction-driven homing beacon setting up camp on the rest of the body?
Well, basically anywhere there's repetitive pressure. We see it constantly under the breasts where a tight bra band rubs, on the wrists, under watch straps, on the upper back, and along the shoulders.
Just from normal clothing.
From clothing or any site of previous trauma, those are highly susceptible. Old surgical scars, burn sites, and even the disrupted skin of a tattoo can suddenly turn into an ivory white, parchment-like patch of LS years later.
Wait, I even saw reports in the papers of bluish-white patches showing up inside the mouth, like on the gums and the inside of the cheeks.
Yes, it's rare, but it definitely happens.
But here's where it gets really interesting. This is the paradox that really stopped me in my tracks while reading your sources.
Okay.
Genital LS is infamous for its agonizing symptoms.
Extremely agonizing, yes.
The itch is described as intractable, completely ruining the patient's ability to sleep. And the tears in that fragile skin cause just searing pain.
Awful pain.
But when this exact same disease shows up on the back or the shoulder,
The patient usually has absolutely no idea it's even there. Extragenital LS is almost entirely asymptomatic. No itch, no pain.
how is that biologically possible? It's the exact same inflammatory process dissolving the skin, but one location is agony and the other is totally silent.
It is wild.
I'm assuming this goes back to the environment, though. Like, the back of your shoulder isn't trapped in a dark, occluded environment subject to the irritating acidity of urine.
You hit the nail on the head. The secondary irritation is the key differentiator here.
Right.
Genital skin is constantly exposed to urine, which contains uric acid and ammonia. And those are substances that are incredibly harsh on skin that has already lost its protective barrier.
That makes sense.
Plus, the anogenital area is loaded with highly sensitive nerve endings. So when you combine missing skin layers, harsh chemical exposure from urine, and dense nerve networks, you get blinding pain and severe itch.
And a patch on the back simply doesn't face those environmental hostiles.
Exactly.
But the patches on the back do have a unique visual tell, according to the sources, something called follicular plugging.
Yes.
And the mechanism here is that the keratin, the protein making up the outer layer of skin, starts to overproduce and actually forms little hardened plugs inside the hair follicles.
Right.
So you get these silent, crinkled white patches dotted with what look like closed comedones or, blackheads.
which creates a massive diagnostic hurdle for
I
doctors
can imagine.
because a clinician might look at an asymptomatic patch on a shoulder with plugged follicles and just diagnose it as a simple localized dermatitis.
Well, sure.
And then they might look at the severe itch on the vulva and diagnose a stubborn yeast infection. Patients often spend years bouncing between incorrect treatments simply because the disease wears so many different masks.
Wait, if the skin is this fragile like that shattered antique soap we talked about, and it tears from something as simple as the friction of walking or wiping after using the toilet,
Mm.
what happens when a clinician examines a 7-year-old girl with this condition?
Oh, it's terrible.
Because if you have deep tissue tears, severe redness, and bruising in the genital area of a child, that has to look exactly like the aftermath of physical trauma.
It does. And it is one of the most tragic collisions of misdiagnoses in the entire medical field. The sources explicitly and repeatedly warn clinicians about this.
They really hammer it home.
They have to. The extreme fragility in pediatric LS frequently leads to a misdiagnosis of child sexual abuse.
Because the visual evidence just mimics abuse so closely. I mean, the guidelines specifically mention purpura. I want to make sure we understand the mechanism there, because it's not just regular bruising from getting bumped, is it?
No, not at all. Normal bruising happens when blunt force trauma actually crushes a blood vessel.
Right.
But in lichen sclerosus, the disease has dissolved the basement membrane of the skin. So the tiny capillaries and blood vessels sitting just beneath the surface, they lose their structural support.
Oh, wow. So they're just vulnerable.
Completely. Because they are totally exposed and unsupported, the microscopic pressure of simply sitting down or the strain from chronic constipation, which, by the way, is incredibly common in children with LS.
Oh, really?
Yes, because it hurts to use the bathroom. And that minor strain causes those vessels to instantly hemorrhage.
This psychological devastation for a family going through a child abuse investigation, when the reality is that the child's own immune system is attacking them, it's just horrifying.
It truly is.
It reinforces why getting this diagnosis right isn't just about stopping an itch. It's about preventing catastrophic misunderstandings.
Absolutely.
And if the disease is allowed to run rampant without a proper diagnosis, the physical consequences are permanent. The texts call them architectural changes.
Yeah, because chronic inflammation doesn't just damage tissue, it fundamentally rewires the anatomy over time.
Rewires it.
Yeah. When the body tries and fails to heal these constant micro tears over years, it replaces elastic, healthy tissue with dense, fibrotic collagen.
Right, scar tissue.
Exactly. And in women, the scarring process causes the labia minora, the inner lips, to literally shrink and resorb.
Resorb, like disappear.
Yes. The fibrotic tissue pulls the architecture inward until the labia minora completely disappear into the surrounding skin.
Wow. And that dense scar tissue can also bury the clitoris, right? Which traps natural secretions and forms intensely painful pseudocysts.
That's right.
And the tissue tightening doesn't stop there. The shrinking process, which is called introital stenosis, it physically narrows the vaginal opening to the point where sexual intercourse becomes excruciating or even physically impossible.
The mechanical function of the anatomy is just destroyed. And in men, this same fibrotic scarring fuses the foreskin to the glands, creating severe phimosis.
So the foreskin becomes trapped.
Right. It becomes a rigid ring that cannot be retracted. It causes painful erections and can aggressively scar the urethra, which permanently alters the urinary stream, causing spraying or extreme difficulty voiding.
As severe as that structural destruction is, there is an even higher stake buried in the 2021 European guidelines. And it's the ultimate consequence of ignoring chronic inflammation.
Yes. Untreated or poorly managed anogenital LS carries roughly a 5% risk of developing into squamous cell carcinoma.
Which is a very serious form of skin cancer.
It is.
But why does an autoimmune skin condition cause cancer? I mean, we usually associate skin cancer with UV radiation from the sun, not like friction and immune responses.
Well, it comes down to the chaos of rapid cellular division. Every time the skin tears from that Kogner phenomenon we talked about, your body has to frantically produce new skin cells to patch the hole.
Okay, that makes sense.
But when you force cells to divide rapidly and constantly in an environment that is highly toxic and saturated with inflammatory cytokines, the cellular machinery makes copying errors in the DNA.
And a DNA copying error is the genesis of a cancer cell.
Precisely.
So the 5% risk isn't because the immune system is somehow actively creating cancer. It's because the immune system is forcing the skin to rebuild a house that is on fire. over and over until a critical mistake happens in the blueprint.
Which is why lifelong clinical monitoring is an absolute non-negotiable requirement for these patients. Even if the itch stops, even if they feel completely fine, the microscopic inflammation could still be forcing those dangerous cellular divisions.
Wow. Which brings us full circle to that massive paradox we started with.
The warning label.
Exactly, the warning label on the medication.
Good.
If we know that inflammation is destroying the architecture and risking cancer, we obviously have to put out the fire.
Right.
And the universal gold standard across every single source in our stack is an ultra-potent topical corticosteroid, most commonly clobetasol propionate.
Alongside heavy, bland emollients, yes. You use thick, moisturizing ointments like petroleum jelly to create an artificial physical barrier on the skin.
Okay.
And this protects the vulnerable tissue from the acidity of the urine and drastically reduces the mechanical friction that causes the Koebner phenomenon on those inner thighs.
Okay, but I have to push back on the steroid aspect here.
Sure.
Because I am still hung up on that bold warning label. I understand the inflammation is the fire. But using a renowned skin-thinning chemical on tissue that is already shattering like degraded silk.
It sounds bad.
It sounds like throwing a grenade into the fire.
Yeah.
How does adding a chemical that causes atrophy not instantly dissolve whatever thin layer of skin the patient has left?
I know, it is the ultimate counterintuitive treatment.
Yeah.
But if we connect this to the bigger picture, you have to look at what is actually causing the thinning in the first place. When a totally healthy person uses an ultra-potent steroid for too long, the steroid suppresses their normal, healthy collagen production, and that causes the skin to thin.
Right.
The warning label is meant for them.
Oh. But the LS patient isn't dealing with normal collagen production.
Exactly the opposite. In an LS patient, the thinning isn't happening because of a lack of production. It's happening because inflammatory enzymes are actively slaughtering the existing tissue.
Wow.
So the ultrapotent steroid acts as a targeted strike team. It binds to the glucocorticoid receptors inside those rogue T cells and literally shuts down their ability to produce those destructive enzymes.
Okay, I think I've got an analogy for this.
Let's hear it.
Using a strong steroid here isn't like taking a wrecking ball to an already fragile house. It's more like using a really heavy-duty chemical fire extinguisher.
Yes.
Does the extinguisher make a mess? Is it harsh? Sure. But you have to absolutely smother the chemical fire that is burning the house down before you can even think about rebuilding the walls.
That is a perfect way to visualize it, because once the steroid smothers the inflammatory fire, the destruction stops. And remarkably, the skin can actually begin to heal itself.
Really? It can come back?
Yes. The sources note that with proper, consistent treatment, which usually means applying a pea-sized amount daily to start and then tapering down to a maintenance dose, the skin can regain some of its normal texture and thickness.
That's incredible.
The risk of malignant cancer drops significantly, and the architectural scarring is totally halted.
So we cannot let the warning label scare us away from the fire extinguisher.
Definitely not.
The guidelines are adamant. This is a medically necessary exception. And I think that brings us right back to the focus of today's deep dive. You asked if LS skin changes can extend into the groin folds or onto the inner thighs.
And we know the answer is definitively yes, driven entirely by that Koebner phenomenon.
Right.
The mechanical friction of everyday movement pulls the confused immune cells outward from the vulva or perineum right into the genitocrural folds.
But knowing the why hands you the control. Because if friction and moisture pull the disease to your inner thighs, then barrier ointments, friction-reducing clothing, and properly applied steroids can shut that migration right down.
Exactly.
The narrative that this is an untreatable progressive nightmare just isn't supported by the science anymore. The tools exist.
When you understand the mechanism, you strip away all the mystery. You move from being a passive victim of a skin condition to actively managing your microenvironment.
Absolutely. But before we wrap this up, the sources left us with one final, fascinating thread that kind of flicks this entire conversation on its head.
Oh yeah, this is really cutting edge.
Because we've spent this whole time analyzing LS as an external interaction. Friction on the thighs, urine on the vulva, steroids on the surface. But the very latest research is actually looking inward at something called the gut-skin axis.
It's a massive paradigm shift in dermatology. Researchers are now finding that the populations of bacteria living in your digestive tract, your gut microbiome, and your vaginal microbiome act as master regulators for a systemic inflammation.
We're talking about specific bacteria, right? I think the text mentions Staphylococcus aureus.
Yes, exactly. The gut houses roughly 70% of your entire immune system.
70%.
Yeah. So if the bacterial balance in the gut is thrown off, certain bacteria can overgrow and literally leak inflammatory cytokines directly into the bloodstream.
Like a leaky gut situation.
Right. And these alarm signals travel throughout the body and lower the threshold for autoimmune responses everywhere, including the skin.
So the immune system is already on high alert because of a chaotic gut microbiome. And then, when your inner thighs rub together, creating that Koebner friction, the primed T cells violently overreact.
The skin is simply the battleground. The marching orders might actually be coming directly from the digestive tract.
Which leaves us with a wild thought to mull over for you. We've been hyper-focused on the surface, the crinkled skin, the barrier creams, the friction of walking.
Right.
But as research evolves, could it be that the ultimate treatment for these painful, friction-triggered skin patches on the inner thighs doesn't begin at the pharmacy counter at all?
It's entirely possible.
Could the key to shutting off this rogue immune response actually start deep inside the dark, complex ecosystem of our gut?
It really suggests that the future of treating this agonizing skin condition might look less like a topical ointment and much more like internal ecological management.
Changes the entire map of the disease. At the top of this analysis, we talk about how medical diagnoses usually feel precise, like an X-ray.
Yeah.
Lichen sclerosus is the ultimate murky water. The disease masquerades as abuse in children. It hides silently on the shoulder while devastating the vulva, and it spreads simply because your thighs brush together when you walk.
It's a master of disguise.
It really is.
Yeah.
But once you illuminate the mechanisms, the Koebner phenomenon, the steroid paradox, the underlying inflammatory cascade, the mud settles, you see the machinery.
And seeing the machinery is the first step to finally taking control of it.
So true. Thanks for trusting us to navigate this stack of research with you today. Keep paying attention to those intricate details and keep asking those highly specific questions.